The joys of doing multiple things. So as we said today, we're going to have the special guests Ramon and Terry. They're both going to have things for us. The topic of the session is your body, your health. To give you a little bit of information who Ramon is I've known Ramon for maybe about over 3 years or so. And Ramon has been practicing pharmacy for over 7 years. And he's currently a clinical pharmacist that does a lot of amazing things, helping with people, involved in helping high-risk patients to optimize the quality of life. For the past few years, 5 years, he's been heavily involved in the opioid stewardships, transition of care, disease management, medication reconciliation, and numerous other things that I can list off, but it will take a little bit too long. And so one other thing about Ramon is he's also part of the Asian Leaders Alliance leadership team as a volunteer. And he's one of the main leads for the Gateway program right here that we're doing together. So to kick it off, Ramon, would you like to take over?
Yes, thank you, Jimmy. And thank you everyone for joining. Thank you, Terry, for joining. And let me share my screen. Okay, can everyone see my screen?
Yep.
All right, here we go. So today I want to just talk about you. So how's everyone today? How are you feeling? Thumbs up, just like, so basically, today is all about you, okay? Your body, your health. Everyone has been going through the pandemic, going through different phases of life where you're just overworked with something. You have these, all of these items you have to complete, whether it's work, volunteer work, or personal life. You have all this focus here outside, externally, but sometimes you don't really take care of yourself, and this is what I'm here for today. So, and this is what I want to talk about, is talk about you. And so before I go on, so I want to, I'm not promoting anything. It's not like a Dr. Oz show, but I just wanted to, it's all evidence-based evidence-based guidelines that I'm presenting to you from my personal experience. And before I go on, I want to give a disclaimer. So this presentation is not meant to offer medical advice. It's not intended to establish standard of care. You want to consult with your professionals in these areas if you have any related concerns. The views and personal experience expressed in this presentation are solely based on the author, me, and do not represent the views and opinion of my current employer. So with that being said, I just want to go over some of the objectives here. So mainly I'll be talking about health and wellness, but more of at a surface level. So there's so many things in this, that in this presentation that I can go way in depth, but I just want to touch a bit on it so that you have some kind of understanding, and also just to maximize your visit at the doctor's office. So we'll define what health and wellness is, identify and alleviate symptoms of burnout, understanding what to expect when visiting the doctor's office, understanding basic vital signs and what common lab values are taken, and identifying proactive preventative health measures. So before I go on into the presentation in general, I want to give us some definitions. So what is health and wellness? The definition of health is basically the physical manifestation of your condition of your body over time. So basically anything that's within you, your skin, your heart, your liver, your lungs, your digestive system. Unfortunately, this slows down over time. This is what aging does. Your heart slows down when you age. Your digestive system slows down when you age. And you basically have to be aware of how to take care of yourself. And for now, there are no anti-aging pills, but in recent fact, there's a recent news showing that scientists were able to rejuvenate someone's cells 30 years younger. So the future maybe is near. We may be able to live forever. Who knows? But for now, we have to talk about how to take care of yourself. Wellness is more of the external component, right? So basically, the balance of one physical and spiritual, emotional, intellectual, and environmental and occupational well-being. Anything that's outside, your social life, your work-life balance, and your relationships with people. So anything that's external that affects you negatively could actually also affect your health, which is internal, affects you internally. So yeah, this is why having a good balance of health and wellness is important, because whatever you're doing on the outside will affect you on the inside. So just want to give some little facts here and statistics. People, they do have daily work, the daily workload, their tasks, their priorities that their managers would give them. Sometimes you have these deadlines that you have to complete, or your boss would just push you to do things that you're unable to do or to finish. That in addition to not just work, but basically your personal life, your relationships, your doing volunteer work for the community. Everything can all lead to burnout. And this is not just applying to just Silicon Valley, it's applied to just globally. But this is one statistic here. Is Silicon Valley according to Business Insider, Silicon Valley workforce is feeling more burnout than before the pandemic, with nearly 70% reporting from work from home exhaustion. So you just sitting down at home and just working in your own space, how are you getting burnout, right? Because you're in your screen, you don't have the ergonomics, your stand-up desk, and you're not really interacting with anyone else. So it's basically how you handle yourself, at work, even whether it's at home or in the office. And I also want to mention any questions, Q&A questions, please feel free to put it in the chat box, and Jimmy will help moderate that, and we can ask questions at the end. So I also want to acknowledge that April is National Stress Month. So you just want to take this time to actually recognize that, okay, mentally and physically, how, where are you? Are you burnt out? Are you exhausted from what you're doing? And just to recognize that and understand that it's okay to be stressed. You have to and just recognize it. I'm not saying April is the only month to recognize stress, but there are other, you always have to recognize it continuously. There's also other random stress national days, like National Hug a Dog Day and National Bubble Wrap Appreciation Day. So I don't know how they got April as a National Stress Month, but it is what it is. So I want to talk about the difference between stress versus burnout. Stress can actually lead to burnout. So if you are basically overengaged with activities or tasks or priorities, where you are basically assigned like many projects, or just overwhelmed with personal life, whether you're taking care of your kids, or even going with the community. It's like you just want to keep doing this because you want to please whatever you're trying to accomplish, right? So please your boss, or you want to you're just getting paid 8 to 5, so you want to get your work done so your boss will be happy. So then you just get overreactive and get urgent and hyperactive. So imagine you're sitting in a car in traffic, right? And it's like this 3 to 4 hour traffic, and you're basically trying to get through traffic, but you can't, because you're just getting one thing keeps cascading over others. So then you get hyperactive, you lose your energy, you get anxious, and the primary damage is physical. So burnout, on the other hand, is more characterized by disengagement. You don't really care about what's going on anymore. So imagine like a dam, okay? So the water in the dam has broken, and it just like spread all around, and you're just like submerged in your own subconscious. You don't care about what deadlines are, what's going, what's due the next day, or what you're supposed to submit to your boss anymore. It's like, what can you do? You're just hopeless. You don't feel like you can't help yourself anymore, and your emotions are blended. You just lose motivation, ideas, hope, and this leads to detachment and depression. And this is more, an emotional burden. It may also make seems like your life seems not to be worth living. So it's also important now. So stress will lead to burnout, but these are some questions that you can ask yourself if you actually do get burnout. Have you become cynical or critical at work? Do you drag yourself to work every day trying to get started? Are you happy what you're doing? So I mean, not saying every morning people have issues getting out of work, because who likes to wake up in the morning, right? But I mean, just don't want to get to work, become irritable, lack of energy, being productive, finding a hard time to concentrate. You just so focused on, you can't really focus on any other things. Just you just feel like your emotions are blunted, lacking the satisfaction of your achievement. You have all this achievement that you've done, but you're not really happy, feeling disillusioned, using food, drugs, and alcohol to make you feel better. Think that you have this void that you want to fill because you're not happy where you are and you just don't know how to complete that hole. Your sleep habits changed. Are you able to sleep well? Are you troubled by unexplained headaches, stomach, bowel movements, or any other physical complaints? So, these are some examples, or it's not really a comprehensive list, but this is more of a questionnaire that you can basically identify, ask yourself, are you feeling this way? And if you are, then you may, experience burnout. And some tips to help with burnout. So if you look at the link down there, helpguide.org, this is basically a website that's peer reviewed by psychiatrists and psychologists that, I got from this website. I'm not a wellness coach, but, they provide really good information here. So what we basically went over is we recognize the symptoms, understanding what is causing you with stress or burnout is the first important key. Then turning to other people for help. So you want to reach out to people that's closest to your friends. So any of your friends, that's what friends are for, right? If friends are there to lend an ear whenever you need help or you have something to say. And if you don't, if they're not there for you, they're not really your good friends. I mean, a good friend is hard to come by, right? So talk to your coworkers. Everyone has their own work wife or work husband. They're there to listen to you, to just talk about anything. Avoiding negative people. So that's one thing that you want to do is avoid negative people. A negative and a negative won't really make a positive, but math it does, but in real life it doesn't, because someone else that's burned out talking to someone else that's also burned out would just cascade, just going down the rabbit hole and just cascade down to a spiral where you just feed off of each other negative emotion. So always talk to someone that's positive. Relook how you look at work. Find value in your work. If you're not happy with what you're doing at work every day, you don't have the satisfaction of you being happy, what you're doing, or in 5 or 10 years from now, can you imagine yourself doing the same thing over and over again? If you don't, then maybe it's time to, find meaning, find your calling and satisfaction elsewhere, whether it's another company or career change. Happiness is the key to your health and wellness. Reevaluating your priorities. Don't always overextend yourself and say no when needed. I mean, I'm a people pleaser too. I always say yes to people when sometimes I can't handle it. So just know how to say no, and just tell your boss or whoever that you don't have the bandwidth to do so. Take daily break from technology and work. You want to get plenty of sleep. That's so take daily breaks. When you get your lunch break, take your lunch break. I myself, I'm guilty of not taking lunch. And just working and eating. The purpose of the lunch break is to take break, just to relax yourself, to just reset and refresh, and get plenty of sleep. It's always good to get your 8 hours sleep, because either whether you have caffeine, the caffeine will basically stimulate you, but it's like is your body is still not it's still sleeping, right? So you gotta get your full 8 hours sleep so that you can get refreshed the next day. So even I myself, I stopped drinking caffeine. I only drink socially when I went with friends. So I think myself, to my belief, I think that going with a biological rhythm is better than just like force feeding yourself with caffeine. So that's the wellness part. Okay. So now I want to talk about the health portion. So the health portion, I'm going to divide this into two different segments. So going to the doctor's office, we're going to talk about when to see the doctor, when you go to the emergency room, what is an emergent symptom, when you go to the ER, and when you go to the doctor when you are actually, just seeing for a very regular checkup. So before we actually go on, I want to also, have some definitions. So according to JAMA, the Journal of American Medical Association, a symptom is a manifestation of a disease apparent to the patient of him or herself. So basically whatever you are describing to the doctor. So it's like, oh, I have shortness of breath, or I have, this bump on my skin. And so whatever you're telling the doctor, that is your subjective. That is a symptom. And it is important to be observant, because whatever you tell your doctor, you want to maximize your visit to the doctor by being truthful. Your doctor is the healer. They're there to help you. And if you're not being honest with them, you're not being observant or honest, then they're not going to know what to give you a final diagnosis. So the doctor would do its best to actually confirm your symptoms, but just also be be observant to yourself from your head to your toe. Just see if there's anything that's going anything wrong that's unusual with yourself. A sign is more of a manifestation of disease, where a physician perceives. So a doctor that confirms your symptom with what you say, then that's basically a sign. So a sign is more the objective, okay, for what your doctor perceives, and the symptoms is the subject of what you tell the doctor. So when the doctor interviews you. So now talking about when to go to the ER, the emergency room. So after, say you have your sign of symptoms, and so the emergency room, I want to emphasize this, okay? They're only meant for serious and life-threatening conditions. You don't want to go to the ER for cuts, or if you just recently went to the ER and you just went for a cough and cold infection, and then it's like 3 days later, you're not feeling better, don't go back to the ER again. The ER is only for life-threatening conditions, because think about it. There are actually people that actually has life-threatening conditions, and by you being there, you're delaying their care. And by law, every hospital or whatever, we have to see every patient. We can't deny them and say, no, we can't see you because you're not important, right? It's like everyone has to be seen. So only go when there's life-threatening. One other common thing is people go to the ER to refill their medications when their doctor's not available. This can be done elsewhere, right? So again, go to the ER when there's a serious and life-threatening condition. So urgent care, on the other hand, can handle non-life-threatening conditions that serves as a walk-in clinic for patients who can't see the doctor immediately. So things like you can actually refill your medications there, or actually go there if your doctor's not available. You can actually go there and they can show you your bottle, and they can actually write a new prescription there. So I'm going to talk about more of the symptoms for ER versus urgent care a little later. But urgent care is a little different than minute clinic, because minute clinic is basically can happen, extended hours, after the regular clinic hours. Urgent care is a little 2 tiers below ER, because it can provide additional care that a regular provider office can. So if you're not sure about ER versus urgent care, the symptoms, a lot of insurance companies, they would actually have 24/7 triage nurse lines, or you can call your provider office that also has triage line that you can talk to your nurse, like, hey, how am I feeling? Am I supposed to go to ER, urgent care, see the doctor's office? So I just want to give a little statistic here. from Blue Cross Blue Shield in 2015. The average price of ED visits in 2015 was $2,259. Urgent care is $168. This is a 13.4 times increase. But keep in mind that, if you're paying copay for ER visit, the reason why some of the insurance company, they would increase their copay for that is because they want you to actually see your doctor rather than just like going to the ER and just like getting it done. So that's my point on that. And these are basically this is basically a comprehensive list. It's not really an all-inclusive list of certain symptoms that you can experience from ER versus urgent care. So it's just take it with a grain of salt. I mean, you always talk to your doctor about this. And in each symptom are just like, depending on the context as well. So you have shortness of breath, chest pain. Yes, that's definitely an ER visit. Trauma to the head. Yes. If you overdose and like allergic reactions. So this one is, I want to put a little asterisk on here, because if you have an allergic reaction and you already have an EpiPen, and say after a couple of minutes, you can still breathe again, you don't have hives, then yes, I think you're fine. But I would still recommend seeing the provider office to let them know that you have an allergic reaction. But if you do have if you don't have an EpiPen, or you just experienced an allergic reaction that you really don't know, then yes, you want to go to the ER for this. Severe infection. So not all infections are emergent. Okay, so UTI or skin infection, that is not really an emergent infection. It depends on the type of symptoms you have. So if you have fever, chills, body aches, nausea and vomiting, then yes, and what's the low blood pressure, or your skin, for skin infection, you have like red streaks going down, the line of the lymphatic system, then potentially it could be, paired up with the fever, chills, and body, then yeah, it could be emergent infection. So that you have to basically talk to your triage nurse about this, okay? So urgent care, on the other hand, is a little bit different. So urgent care is not life-threatening. You can actually go to the urgent care to see bug bites. You have a spider bite, or if you got drunk one night and you just need fluids, they have IV lines. They can just hook it with fluids. So you can refill your medications on there, and they actually see yourself with flu and cold symptoms. So it's like some urgent care, they actually can they can test you for COVID too. So these are just like some differences between ER versus urgent care. Urgent care is a lot cheaper than ER. So just, if you're not sure, just talk to your nurse and your provider about it. Okay. So whether you're going to the ER or seeing your provider regularly, your doctor will always, question you and ask you questions, right? So, and this is why the providers, they're really good interviewers. So this is one of the templates that we learned in school, in pharmacy school. There are other templates that provider uses, but this is just one example. Okay, so some of the questions could be for precipitating palliative. Does anything make your symptom worse? Do you know what caused your symptom? Have you tried anything to relieve it? Quality, what did your symptom feel like? Where is your symptom located? Radiation. Does your symptoms spread to other areas, whether it's to the chest or to the shoulders? Severity, how does your symptom affect your daily quality of life? Temporal, how have you been experiencing these symptoms? Is there any time of the day your symptoms get worse? How long has the symptoms last? Is it continuous, intermittent? Are you experiencing any other of these symptoms? So these are some of the questions that you can think about as well when you go to the doctor's office to maximize your visit. So I can give a quick example, do a little quick role play between me as a patient versus me as a doctor. Right? I'm not the medical doctor, I'm a pharmacist, okay? But this is just an example. It's like, oh, hey doctor, so how are you feeling today? So yeah, I've been, feeling a little, my chest a little tight, getting a little short of breath after walking, 2 blocks. Like, oh, I'm sorry to hear that, sir. Do you know when did it started? So yeah, it just started 2 days ago. I was like, okay. Have you used anything to treat the symptoms? And I've used some albuterol. So basically it's an inhaler to help me with my shortness of breath. I was like, okay. So, and then with your chest pain, does your chest pain, like, does it stay in one place, or does it really go on up to other places? Like, yeah, it just stays in one place. And is there any time of the day where your symptoms get worsened? And it's no, it's just only when I work out. And then the last thing I want to ask is a couple of other questions for you. Do you experience these symptoms after you eat? Do you experience these symptoms when you do you experience these symptoms after you eat? Or another thing is, do you have issues with shortness of? Do you have issues with shortness of breath when you're sleeping? And it's like, and the answer is no. And do you have any history of cardiovascular history with your family? And so, yeah, my family does have cardiovascular issues. My mom has a stent, and my dad has high cholesterol. And he does have history, does have troubles getting up. He does get short of breath in the middle of the night. So what's going to happen next is the doctor said, okay, so I see that you're on your inhaler. So you do have asthma. So what I will do is I'm going to do some physical exam, run some tests, and see, see what the results are. And, it seems like your asthma has worsened, but we have to double check and see. So this is an example scenario of what you would go through to the doctor's office. So whether the doctor's office is within the ER or in person, during the pandemic we had to pivot our way to using technology, right? Because we wanted to be a good Samaritan and try to prevent the spread of infection. So the popularity of telehealth has skyrocketed. Telehealth uses technology to deliver services at a distance. So according to the United States Healthcare Services, the studies show that there's a 63-fold increase in Medicare telehealth utilization during the pandemic. So this is actually it's a good thing, because you're actually now delivering care, in a way where you don't have to be in the doctor's office. And there are actually advantages and disadvantages to this. So the pros is convenient and accessible, right? You don't have to drive to your doctor's office and actually get care. It's cost effective. A lot of insurance companies, they usually use zero copay or very little copay when they see you, because all they're doing, they're asking questions. They're not doing any physical exam. Improved timeliness of care. I mean, they're only asking questions, and there's probably 15 to 30-minute time slot where you just move on to the next patient. There's less stress on the doctor. It may equate the same level of care depending on the type of a follow-up, right? If it's just a regular follow-up with your diabetes, and you're just providing with your provider with your sugar levels and you're doing fine, then that could be done with televisit. But if you say you have cancer and you want to check on your chemo, check on your blood work, then yeah, that requires more of an in-person visit. Same with maybe an injury or something. If you big injury or small injury, right? You want to go to physical therapy, and they will check you just to continue with your physical therapy. So the cons, adaptations to technology, and not a lot of people are pro technology, so they have a hard time getting into it. Fewer in-person consults. So I'm not saying that physical exam is not important. It's very important, because your doctor will have to listen into your organs to examine how how you're doing. There's technology that only can be used on site rather than at home, right? So and then if your in-person visit will also reduce the continuity of care, because if you're already at your provider office, and the lab is right there. You can just go to the lab and get your blood work, as compared to, just you being at the doctor's office. I mean, at home, and you just like telling your doctor that you just talk to your doctor, and your doctor recommends you to take a lab test. You have to drive to a lab test, and not a lot of people want to do that. So that's telehealth. And it's basically an article that's showing that that my friend wrote, that access to telepharmacy may reduce hospital admission in outpatient population during COVID-19 pandemic. So it's basically an article, double-blinded, retrospective double-arm cohort study. And this is it shows that telehealth does work, but depending on the type of condition that you're treating it with, right? You're working with. Another thing that I want to talk about is, provider also asks you questions, but they will also ask you questions with your social and family history, because this is pertinent to your diagnosis, whether your family has any genetic risk for certain diseases, or they have certain previous disease where you work. It could be occupational hazard of the environment, recreational history, any social, what you do, off of work, or with your friends, whether you're drinking, smoking, etc. Your social class, your ethnicity. Certain ethnicities, we have a higher risk of more disease, getting a disease state. African Americans have a higher chance of getting sickle cell anemia and asthma, COPD. East Asians, they're higher chance of getting hypertension or diabetes. Religion is also important, because that dictates the diet. Jehovah's Witness, and then the medical history. So all this is important to formulate a diagnosis and to help create a care plan for you, the patient. And I just wanted to just touch base on, also, this is more like a population health kind of thing, a social determinants of health. So education, how well you're living, academic stability, your connection to the community, how well your neighborhood is built, all ties into basically your access in healthcare, right? If you don't have the money to purchase food, all you do, you're eating junk food every day, right? So this is like very important. Like your social health, your social determinant determines how you're living. And it's whether it's transportation or whether it's living in a safe environment, it basically affects you mentally, physically, and mentally. And just talking about the equity part, when providers seeing patients, they are also incorporating culture, the culture sensitivity, the culture barriers, their own culture. The members, the patient's culture, so that they could basically interact with them in a way that they understand them, and breaking barriers. So like you don't want to tell someone in the Muslim culture to eat pork when you're telling them about diet, right? So it's something like that, but just basically telling them, basically going down at their level. And this is why also translation is also important, because it breaks barriers. So I know this is kind of a little backwards, but nurses usually take your vital signs before they interview you. But I just wanted to group it in a way so that we can talk about the vital signs and labs. So vital signs are basically the objective measurement of the essential physiological function. So temperature. So temperature is one vital sign. So temperature is important because right now you are at a normal body temperature, right? You're not really hot, you're not really cold. When you get really hot, you want to turn on the fan, right? You want to go in an AC. So having high body temperature, it's not good, because actually high temperature can actually denature your proteins in your body. It can actually just hurt your organs. And this is why it's important to when you actually get a fever, you would take Tylenol and also take something cool, so that you lower the temperature down, so that your normal temperature, or your normal body temperature. And yes, your body is smart. It does have thermal regulation, but it does help your body if you actually assist it. It takes some rest, and just basically when you have a fever, your body is just telling your brain, it's like, hey, I'm fighting this infection. So I'm setting some inflammatory markers so that, just let you know that you should get rest. You shouldn't be doing all these activities. Same with, if you have in contrast with a low temperature, low temperatures can actually lose, it can slow down your circulation, and it prevents oxygenated blood from going, circulating around in your body. So the hyperthermia is real. So just also you also want to be within normal temperature. So blood pressure is another thing. Blood pressure is basically the pressure. There's two numbers. The first number stands for the pressure when the heart pumps blood, contract blood to your throughout your body. Okay. The bottom number is when the heart fills the ventricles and just relaxes. So why blood pressure is important? Because you're basically, whatever that pressure your heart is pumping, that pressure is basically distributing all your blood to your body. Right? And then the reason why you want to maintain your blood pressure, below 130/80, this is per the ACC/AHA guidelines. I can give you an example. A lot of people you see here doctors say, on TV shows like, oh, you don't want to eat a lot of salt. You want to have enough salt intake, right? You don't have to go above 2.4 grams of salt, because what salt does is basically it just tells to your kidneys like, hey, there's a higher concentration of blood. Your blood concentration increases when you take salt. So your kidney just like, okay, what I'm going to do is I'm going to retain water. I'm going to take in more water, dilute the blood, and think of it as a pipe or hose. And then the heart is like, okay, so now I have to adjust and I have to increase my pressure to pump all this volume throughout the body. And the heart is smart; it does adjust to this, but over time, if you keep doing this to your heart, what it does is your heart would just like, okay, will keep maintaining that temperature, right? It's going to continue to build more muscle in your heart, so your heart gets bigger, and this would lead to heart failure, right? So, and because you're pumping more volume throughout the body, so managing your blood pressure is important. Your heart rate is kind of correlated to your blood pressure, because if you have a higher heart rate, your blood pressure could also increase. But this doesn't account when you have arrhythmias. This is different because that's basically the electrical signals in the heart. So it depends on the context of that. So high heart rate means tachycardia, greater than 100 beats per minute. Bradycardia means low heart rate, less than 60 beats per minute. The respiratory rate is also important. You want to make sure that you're breathing between 60 to 20. I'm not saying you count how much breath per minute that you're taking, but I'm not going to go deep into it. If you have questions, I can go over it after, because I know we have a couple of time, 15 minutes left. But O2 saturation is basically your blood cells carrying oxygenated blood throughout your body. So just the thing that your doctor put in your finger. So lab values. Lab values is whenever your doctor would, after you complete your doctor visit, right? So he would just say, okay, I want you to take a blood test. And some of these blood tests will include, the following: the comprehensive metabolic blood panel. This is basically measuring your electrolytes, fluid balance, and how well your kidneys and liver are working. Your complete blood count measures your red blood cells, white blood cells, platelets, and hemoglobin. Basically, just your cells in general, right? So lipid panel is help measure your cholesterol. Thyroid test measures how well your thyroid is doing. Your thyroid helps with thermoregulation and metabolism. Hormone test is to see if your hormones are within normal range. So these values are just an example of what you can expect. I'm not gonna go over all of them, because all these values here, when you go to a physical exam, this is what I would always recommend in asking your doctor once a year. Just ask them if you can do these kind of tests. But this is what it looks like. This is like AST is more of like the liver, glucose, potassium. This is what complete blood count looks like. This is what cholesterol and thyroid looks like. And this is not like to the book, okay? Certain hospitals or clinics, they have different, variations of this, or depending on what, what they're using in the lab. So they have their own versions of this, but it's technically around the same. So just keep in mind that there's the distinct differences here. So what is considered healthy? So the World Health Organization defines health as the complete physical, mental, and social well-being, and not merely just the absence of disease or infirmity. So basically just your physical, mental health in general, okay? Usually your doctor will tell you what's healthy, but this isn't really an example scenario of your physical health. And this scenario only applies for an example in a perfect world. So not just because you don't have any of these doesn't mean that you're not healthy, okay? So you always want to talk to your doctor about it, but when you think about health, think about your blood pressure, think about your cholesterol, your lab and values of a normal range. So, and no findings on the physical exams and scans. So if you look in your discharge list and any scans or whatever, and you notice they said unremarkable, that's considered normal. That's not because you're not unremarkable. You are remarkable, but it's just saying that there's no finding, which is what you want to find. There's no findings. You want to come home from your doctor's office with no findings. Your BMI, your basal metabolic index. So this basically measures your body composition in terms of weight per the kilogram per meter square. So if you're in between, your BMI between 18.5 to 24.9, that's good. I mean, if you're over, that's fine, as long as you don't have any cardiovascular issues and just keep in mind what you're eating, you should be fine. No smoking or drinking, practicing safe sex. And if a doctor finds something, doesn't mean that you can't live healthy. Okay, with certain lifestyle modification and time, and sometimes even medication, you could continue your day-to-day activities of a normal lifestyle. So next is the most important thing that I want to talk about is preventative health. And I want to be more inclusive of this. This is preventative health for men and fully transition men. So anyone else that in the other transgender population, we have to talk to your doctor about it. So this is basically for this, and because just want to keep it simple. So for men and fully transition men, want to usually do a yearly physical exam, including vital signs, cholesterol, sugar, testosterone, thyroid, liver enzyme, your complete blood count. Yearly visit to a dentist. Visiting your dentist is important. Okay, cavities is bad for you because it can actually cause infection. It can cause a blood infection. It could actually lead to, the blood infection can actually go to your heart too. So it's important to actually check go to the dentist yearly, and also they also check to see if your gums are healthy, right? If your gum lines is receding, then you're gonna be losing your teeth. So take good care of your teeth. And per the American Academy of Ophthalmology, if your eyes are healthy and good, it's recommended to get your eyes checked once in your 20s, twice in your 30s, and once in your 40s. And there are exceptions though. You have diabetes, your eye have eye issues, then you have, of course, you have to get checked more than just like once or twice. It's more routinely. For vaccinations, your yearly flu vaccine, maybe in the future like COVID vaccine, tetanus shot every 10 years. It's basically a booster shot. You don't want to get tetanus. It's going to really screw up your neurological system. So just get your tetanus shot. It's a little it's a little sting, painful in the arm for a little bit, but it just does you wonders. It does save you from getting that disease. So shingle shot is basically if you have chickenpox when you're little, your immune system gets weaker when you get older, and so basically the virus lives in your spine. So you want to get this shot when you're around 50 years of age. So now it used to be one shot, but now it's 2 shots. HPV, MMR, measles, mumps, rubella, if you haven't gotten it. So for bone scans, usually women are more highly prone to getting osteoporosis, but men also recommend to get it if you're 50 years of age or clinical risk of fractures, or 70 years or older per the National Osteoporosis Foundation. So the United States Post Task Force Survey recommends for colorectal cancer for all adults aged 50 to 75. So this is including men and women. So men are more likely to get it, but women should also be screened as well. For prostate screening, the USPTSF recommends men to be given information about prostate screening between 50 to 69. There's different types of prostate screening. There's the blood screening and the painful one. So I mean, I think they recommend you to provide you that information. Exercise at least 30 minutes a day. Incorporate fruits and vegetables, and grains and dairy and protein, including lean meat, healthy oils in your diet. Limit food intake with added sugars. Take less than 10% of your diet. High sodium, less than 2.4 grams per day. Saturated fat, less than 10%. For men, limit to 2 alcoholic drinks per day. Avoid smoking. Wear sunscreen. And for CDC, if one of your parents are born with high rates of Hep B, you want to get tested for Hep B. And for Hep C, if you haven't get tested, just get tested for Hep C just once. For women, or a fully transitioned woman, basically almost the same as men, but it's just, the vital signs, cholesterol, sugar hormones, liver enzymes, etc. You want to visit your dentist. Eye doctor recommendation is the same. Basically in your 20s, twice in your 30s and 40s. Of course, there are exceptions. Same vaccination, yearly flu vaccine, tetanus shot every 10 years, shingle shots. If you had chickenpox when you're younger, HPV, MMR, if you didn't get it. For bone scans, this is recommended for greater than 50 years of age, or clinical risk factor, or greater than 65 if you're a younger postmenopausal woman or woman is in menopause transition for a National Osteoporosis Foundation. So the reason why women get more osteoporosis than higher chance of getting osteoporosis than men is because when you go to postmenopausal phase, your estrogen gets lower, and that basically increases the chance of giving you osteoporosis. Good, more bone breakdown. Colorectal. So before I go to breast cancer screening. So the USPTSF, the United States Post Task Force, recommends biannual mammogram screening between 50 to 74. The American Cancer Society recommends for 45 years of age. For colorectal cancer, again, 50 to 75. For cervical cancer, they recommend 21 to 30 years of age for a pap smear every 3 years. So basically, a pap smear and HPV testing, they use a little brush and go down to your cervix and just get some cells, and they test to see if you have HPV, or the cells for cervical cancer. And for women 30 to 65 years of age, recommends cervical cancer screening with HPV testing every 5 years, HPV, a pap smear testing every 5 years, or pap test every 3 years. You want to talk to your doctor about the type of screen that you want would work for you. So pregnancy, when women get pregnant, you have higher risk of getting other diseases. So they get screened for gestational diabetes, mainly the 24th week, gonorrhea, syphilis, hepatitis B, RA's incompatibility screening. So what that is so you have the regular blood type, right? AB, ABO, etc. So basically, it's Rh factor is another type of antigen when antibody when you that you also secrete in, that your red blood cells may also have. So if your mom and your parents, your mom and your dad has two different, Rh factors, and when they make you will also have a different Rh factor. So this Rh factor from the baby can actually go into the mom, and if your mom is negative, Rh factor negative, and they detect the positive, that then the mom's immune system will detect that the baby, Rh factor is foreign, and it will start attacking the baby. So what is given, if that's is diagnosed, is ROGAM, and this will basically help with desensitize this with the mom. And the mom wouldn't attack, the parents wouldn't attack the mom, mom blood cell wouldn't attack the baby. Preeclampsia prevention, basically testing for high blood pressure. You have high chance of getting high blood pressure when you're pregnant, and of course maternal depression screening. Again, same diet: fruit, vegetables, grains, dairies, protein, meat, including lean meat, healthy oils in your diet. Limit food added sugars, limit high sodium, less than 2.4, saturated fat. 1 alcohol drinks per day. Women actually get more drunk, or actually they only can take in 1 alcohol drink a day because they have more adipose tissue and that absorbs the alcohol. As for men, we have a higher, more water content in our body, so we're able to take 2. Avoid smoking, wear sunscreen, and for the CDC, test for Hep B again if your parents are born in a country with high rates of Hep B, and Hep C if you haven't been tested. I might just really touch real quick on alcohol. So I know we're a couple minutes left, but alcohol basically metabolizes, used to your stomach and it gets absorbed in your stomach and your intestines. What causes you to get that ill effect of toxicity, the drunken phase, is when alcohol gets converted to acetaldehyde, and that's basically considered toxic to your body, and it causes the ill effects of alcohol consumption. And the reason why some Asians have Asian glow is because they don't have enough alcohol dehydrogenase, the enzyme to metabolize alcohol. These are some of the infographics of what alcohol affects: eyes, head, heart, liver, anything else that causes cancer. Is alcohol healthy? Contrary to popular opinion, it's not. It's any form of alcohol is not healthy. It's like what you hear about wine giving you like good cardiovascular health is not true. Providers would rather have you eat good fruits and vegetables, and rather than just have you continue drinking more. So, and this is basically this part is basically a summary of the evidence, why they think this evidence is weak, and it's not considered. It's not. They don't think alcohol is healthy, and it can't be refutable. So alcohol consumption does increase the risk of cardiovascular risk, as according to the World Health Federation. Safety tips for alcohol: drink in moderation, don't drink more than you can, eat before you drink, always hydrate and replenish fluids. Hangover cure, you want to just get fluid, Pedialyte, Gatorade, don't drink more alcohol. I don't know why people would drink more. The tip for, it's like the darker the alcohol, the worse your hangover gets. Avoid fizzy drinks, so that'll stuff your stomach. Drink some warm soup and chicken soup. And then insurance tip: if you have any issues with your insurance, member service is your friend. Whether it's like your evidence of coverage, or whether it's an authorization, or some issues with case management or any of your providers, talk to your member services and just be respectful, because they're a call center, and call center, it's not an easy job. They have to know a little of everything. So just be appreciative of member services. You can check your evidence of coverage. Usually they would send you a book of what's covered and what's not covered, and use it online. Any service that requires authorization will require your doctor to submit medical justification why the service is needed. And denies decision could be appealed by the member, and it could be appealed by the provider as well. And if that doesn't go through, then that could go through state fair hearing. Complaints of poor services can be filed as a grievance, and if you have a question on social work, coordination of care, I mean, like getting from, making an appointment with your doctor, or you're trying to get a specialist, or disease management. A lot of insurance, they actually do have their own case management program. And in fact, it's kind of a requirement because it's a kind of a regulatory requirement that they want to be on top of their game, and they do offer these kind of services. And lastly, but not least, the over-the-counter drugs. So these are just some common over-the-counter drugs. So pain, fever reducing, Tylenol, some topicals. You want Salonpas or Aspartame. Allergies is less sedating. Everything else but Benadryl. Benadryl is more sedating. Nasal allergies, Flonase, Nasacort, Afrin. Dry eyes, use artificial tears. And if that doesn't work, use the ointment. Eye allergies, Paldase, Always, Zaditor. And so I also want to talk about the cough suppressant versus mucus release. So the cough suppressant will only suppress the cough. So what you commonly see of Mucinex and other products is they have this ingredient called dextromethorphan and guaifenesin, which is a cough suppressant and a mucus secretion. So if you don't have any of those two symptoms, you don't have to take it. Your body will heal on its own. A lot of cough and cold symptoms will heal on its own with rest, but this is more symptom control. And finally, head and cold, sinus congestion relief, you can use Sudafed.